Now, with in-person learning on the horizon, COVID is not the only concern that is top of mind. Nerves and anxiety and mental health, also something to be mindful of. Have a listen to what some teachers and parents had to tell us.
As an educator, I'm very fearful for the mental health and well-being of my students because of the gaps we've seen widen over the past 1.5 years in terms of academics, socialization, food security, and poverty.
I'm worried about my kids who are under 12 and heading back to school in September after 16 months of interruptions and the anxiety associated with further lockdowns as we head into the fourth wave.
So wearing my kindergarten teacher hat, kids need to see facial muscles, and they're not doing that with the masks on. And wearing my teenage dad parent hat, my boy is going to be worried about who is vaccinated and who isn't. It's not good for anyone's mental health.
So look, here to tackle some of these concerns, Dr. Chang, a psychiatrist in Vancouver, also author of The Tech Solution. Dr. Chang, good of you to join us here today.
Good evening, Andrew.
So Dr. Chang, I mean, it's tempting to think of kids like rubber bands, right? You pull them in all kinds of uncomfortable positions, but then they snap back when things get back to normal. How would you, though, temper or complete that thought?
I would say even pre-pandemic, kids were under immense strain, and we knew that stress was the #1 health epidemic with rising rates of anxiety, depression, video game addiction, cyberbullying, all kinds of stuff were on the rise, and then the pandemic hit. So as you just heard by the video callers, this is top of mind: mental health, social connection, resiliency. We are seeing cracks. We were seeing them before. I feel that one of the biggest threats and issues of our time is the mental health and wellness of young people. So after 18 months now, we're seeing the effects of chronic stress, which does have impact on physical, mental, social health. So although kids are highly resilient, and I certainly believe that many will do just fine, we really have to look out for those at risk, those who are already in challenged situations. Have you heard maybe poverty, maybe violence in the home, maybe mental health issues already, and look out for them and plan for a successful school year.
Right, because what would you say is the most common source of anxiety? Is it just the regular back-to-school jitters? Is it that all of this normalcy is kind of flooding back all at once, or is it something else? What is it?
I would say it's all of that, plus, of course, COVID, and many people were hoping that it would be completely gone, and we don't have to wear masks or worry about it or think about it as much anymore. And of course, as you heard, we're heading into a fourth wave. So all of that puts pressure on the young brain. So the young brain, doesn't have the problem-solving capacity. Often it can get overwhelmed. It can get triggered by that freeze, fight, or flight stress response. Freeze is anxiety. Fight is they're irritable, they're angry. And flight is they want to escape. So they're turning to technology, they're turning to social media and video games. Older teens, drugs and alcohol rates are on the rise. So all of that really is coming together in a perfect storm.
Okay, and Dr. Chang, you mentioned technology there, right? And that's something that kids maybe have become, I don't know, a little too acquainted with over the course of the pandemic. And you talk about them, potentially turning back to technology when they feel that rush of anxiety. What is it in that vein that you would tell to parents when they're thinking, okay, how should I help my child through the kind of resumption of school if I'm noticing something is off?
Yeah, so we really have to understand we need to move from screen time to screen quality and start to guide our children to what I call a tech diet. So tech is not all bad, it's not all good. In fact, when we look closely at it, I call it the fire of our time, meaning that it is a human innovation, just like fire, and those that learn how to use it well will go further and farther than ever before. And those that don't can get burned and burn down the village. So we need to teach children that there's toxic tech that is really not good for them, releases cortisol, and that includes things like cyberbullying and the hate online, but also comparing your life to others and that fear of missing out. And social media really contributes to that.
Okay, and Dr. Chang, I have time for one last question. If you were to just give kind of one final piece of advice for parents in terms of how to recognize that something is off, beyond what usually might be off, and then what to do about it, what would you say?
Yeah, so young kids often don't express their feelings. They don't have the language for it, but they can also often experience it in their body. So tummy aches, headaches, and school refusal is a big one, and really not making sense as to why, because they can't communicate. But what I tell teachers and parents and everyone is this, to remember this rhyme. It is where focus goes, neurons grow. Despite all the stresses, despite the anxiety we're talking about, we want to keep the focus on the positive. School is a positive time in many people's lives. It's a time of learning, social connection. So really putting the focus there, planning ahead, and building a routine as much as possible so that you get off to a good start.
All right, Dr. Chang, always good to talk to you. Thank you so much.
Thank you.